So it's been super frustrating writing these papers because I'm left-handed, but process.
Welcome.
To like process, you know, like when you're typing, like the process, like I'll type a bunch of things down and I'll delete it and I'll retype, you know? And I can't do that because I don't have time. So it's like I literally am like trying to think in my head and then like type. It just basically taking like double the amount of things. And I've done that too, but I honestly think I've gone so accustomed to like typing and then deleting and then typing. I like the process. Such a struggle, so I'm adapting. In 4 weeks.
Okay, well, welcome everybody. We'll just wait a couple more minutes. Thank you for coming.
I'm like, at least it's like an easy paper, so it's not men's frustrating, but it's just so frustrating when I come to like try to type it. Yeah.
Like whenever somewhere hurts.
Oh, yeah. Completely. I was saying like, obviously like, I felt like it's different from like animals. I never realized like, yeah, like if I just have to pass, it'd be fine. Like I would be
Or
solid.
even just like, you know, sort of any.
Very awkward. I'll peep over.
No,
you're right.
Oh, wait, that way.
Oh, there you go. I don't know if that's, no, you're right.
Sorry, but I have to bring this in.
You're good.
No, it's okay. You're good, you're
They're familiar with the mask on, but when people take their masks off, we don't know who they are. Okay. Well, welcome everybody. I hate talking. So, welcome. Great chair over there. Chair here. So, Dr. G kindly invited those of you in his class to join us. And I want to introduce our visiting scholar, Gasko. He is originally from Serbia, teaches in Paris at the University of Paris and other schools around there. His background is in law and particularly expert on Brexit and those types of things that he's been presenting all week on mental health issues with regard to Europe and the EU and all that. So he's on the tail end of his time here with us. He's a visiting scholar coming to us by way of a grant from Chicago School. So, you know, Chicago School wanting to make sure you're integrated into the larger global community and understanding how things work outside the United States. And so this is an opportunity for us to learn about how things are done in France and maybe ask questions, that type of thing. So I will turn it over to Gasko.
Thank you very much, Dr. Bacon. Thank you very much for.
Is it okay if you don't wear a mask? Or are you okay? Because communication is, you know.
Is key of the success. Okay, thank you very much. So, as Dr. Bacon mentioned, I'm a lawyer. In law, terminology is very important. So, as in psychology. So, if I make some terminological mistakes, please feel free to correct me, and please interrupt me at any time and ask questions. I will do my best to reply to your questions. So in 2000, the World Health Organization found that France provided the best overall health care in the world. And the French healthcare system is usually ranked among the top 10 healthcare systems in the world. But to better understand how and why one of the best healthcare systems in the world provide the worst mental health care outcomes, we will discuss the organizational aspects of the French healthcare system. Then we'll speak about the state of mental health of the French population. Then about the national mental health crisis in France and some of the announced reforms. So, first of all, we have to understand that France provides universal population coverage. If I can get to the next slide, that's perfect. And that universal population coverage has been achieved over 7 decades by extending the statutory or mandatory health coverage first to all employees and retirees in 1945 after the Second World War, then to all of those who are self-employed in 1966, and then to all unemployed and legal residents that were previously ineligible in 2000. That reform in 2000 has been a decisive step towards providing universal population coverage. After that reform in 2000, it is estimated that less than 1% of French population is without basic coverage. However, those who had been previously eligible, they had to renew health insurance each and every year. And whenever their professional or family situation changed, they had to declare it, and there was gaps in the continuity of the access to the health care. That is why another reform was conducted in January 2016, but the focus of that last reform was not on expanding the population coverage, because 99% of the population has been already covered, but the focus was on providing the continuity of the access to the health care. And in January 2016, universal population based on residency is introduced in France. So if you're working in France, or if you reside in France on a stable or ongoing basis, that would mean at least 3 months, you are covered, and there is no need to any administrative formalities upon the change of circumstances, your family circumstances or professional circumstances. And the French government sets the national healthcare strategy and allocates budgeted expenditures to regional health agencies. Regional health agencies in France are responsible for delivery of healthcare service. Then the general management of the healthcare, the implementation of the government policies, development of safety standards, and the approval of the agreements between health insurance and healthcare providers, and setting prices for medications and medical devices are the main responsibility of the French Ministry of Solidarity and Health. Approximately 80% of healthcare financing comes from mandatory contributions from employers, employees, and self-employed. About 20% of expenditures are funded by taxes through the general taxation by the French government. The healthcare is delivered in an integrated network of private, non-profit, and public providers. Providers of outpatient care are largely private. Hospital beds are predominantly public or private non-profit. The first line of healthcare is provided by general practitioners or family doctors, médecins généralistes. They are mostly self-employed, they work in small practices. Average practice is about 2 to 3 physicians, and everybody is free to choose general practitioner, but must be registered with that general practitioner to claim the standard rate of reimbursement of healthcare expenses. Some specialists can be consulted directly, for example, dentists, ophthalmologists, and psychiatrists without general practitioners referral. And the doctor's appointment with that designated healthcare pathway, general practitioner's referral, is reimbursed at a standard rate of 70%. Serious conditions, costly procedures, healthcare for people who are 65 or older or with chronic illnesses are in general and in principle fully covered. The difference between what is covered by the mandatory insurance and the total cost of the healthcare is covered by something called mutual. Mutual is top-up health insurance that reimburses the difference between what is covered by the mandatory health insurance and the total cost of the care. When I speak about mutual, it is important to understand that since 2016, private companies, they are obliged to offer mutual collective to their employees and to cover 50% of premium. Self-employed students, those in public sector, they are expected to join mutual individual. Mutual individual provides less cover, it is less expensive, but the premium has to be fully paid by insurance. French government, although I'm pretty skeptical about it, says that 95% of French population are covered both by mandatory health insurance and this mutual, this top-up insurance policy. So far, it should be easy and clear, but if there is something that is unclear, please tell me and I will do my best to explain it better. Because this is the moment where things become way more complicated, but that's France and things they have to be complicated. So, national agreements between healthcare providers and health insurance are put in place to be sure that state is not obliged to pay more than what the care costs and that medical expenses are not reimbursed with any state oversight. However, medical care providers, they can opt to charge more than those base rates set in the agreement with the state. So, doctors, clinics, and hospitals that adhere fully to those national conventions and charge only that base rate set in those agreements are known as conventionné 1 or convention 1. There is no better translation for this. So when you say doctor who is convention 1, then this standard rate of reimbursement applies, and the rest is usually covered by your mutual. That would be for conventionné 1. Those who are convention 2, they set up their prices freely with state oversight. And when you see a doctor who is convention 2, then standard rates of 70% applies, but only on the base rates in the agreements between healthcare providers and the healthcare insurance. The rest is covered by mutual, but there will be also out-of-pocket payments. So the main difference, if we try to simplify this extremely complicated system, is that when you see doctors that are convention one, then you can suppose that there will be no out-of-pocket payments. 70% of healthcare will be covered by the state. The rest will be covered by your mutual and top-up insurance policy. When you see doctors that are conventionally, part will be covered by the state, part will be covered by your mutual, and there will be out-of-pocket payments. And when we speak about French healthcare, despite this complexity of healthcare delivery, the France has long been praised for the quality of healthcare system. And as I have already mentioned, in 2000, the World Health Organization found that France provided the best overall healthcare. The French healthcare system allows people one of the best life expectancies. It reached 82.6 years in 2019, and among 38 developed countries of the Organization for Economic Cooperation and Development, France has the lowest rate of out-of-pocket payments, about 7%, while the average is more than 20%. So, to better understand how this great healthcare system provides the worst mental health care outcomes, we will try to understand how the mental health care delivery in France is organized. I would also like to emphasize that regardless of the population coverage that is very high, regardless of low level of out-of-pocket payments, inequalities in the access to healthcare in France remain high. Among the richest 5% of the French population, life expectancy at birth for men is 84. No, sorry, my mistake. It is even more. It is 84.4 years compared to 71.7 among the poorest 5% of the population. That is the gap of almost 13 years. And in 2017, 66% of respondents expressed concerns about patient care in France, and 70% of them thought that health care will be more expensive in the future. France spends 11.5% of GDP on health care, and this figure is significantly higher than in any other European states, or if we want to be extremely precise, only Switzerland spends slightly more on healthcare than France. But in 2018, Euro Health Consumers Index that compares 35 European healthcare systems, France ranked at 11th place, and mental health problems, they cost French health insurance 22 billion euros per year. That would be about 25.2 billion US dollars, and it makes them one of the most expensive pathology ahead of cancer or cardiovascular diseases, but the healthcare outcomes are among the poorest. And warning signs about the mental health care in France were flashing red everywhere, even before the COVID-19 pandemic. So in 2016, 10.5% of French population had consultation for mental health problems or prescription for psychotropic medication. Then, according to Eurostat, Statistical Office of the European Union, 48,000 people died due to suicide in 2017, which makes it the most important cause of violent deaths in European Union. and France has the highest suicide rate in the entire Europe. Figures for 2017, more than 7% of French population considered ending their lives. 5% thought about killing themselves in the past 12 months, and 0.5% of French population actually tried to commit suicide in 2017. In 2018, studies showed that 1 in 5 French residents have mental health problems. And in 2018, it has been clear that mental health services cannot cope with the rising demand. That is why in January 2019, more than 100 French psychiatrists sent an open letter to the health minister. They expressed their deep concerns over the mental health care. They emphasized that mental health services are overwhelmed. They emphasize that the system is at the brink of collapse. Population is rising. More and more people are referred to psychiatrists because of the lack of alternatives. The number of psychiatric hospital beds drops, so people, they had to be discharged too early and they end up being readmitted. Diagnostic delay of several years without any support in the meantime reduces the chances of recovery. Those psychiatrists, they also express their concerns about the most vulnerable, the homeless people, refugees, and detainees. In French prisons, psychiatric disorders affect 78.5% of men and 73% of women. Most of them, they don't receive any treatment. And those psychiatrists also emphasize that mental illness is very often violated, is very often related to violence in the media, which is a misconception, as we all know, that people who suffer from mental illness they more likely to be victims of the crime than to be victims. And then, as you all know, COVID-19 came. COVID-19 has catalyzed many of mental health problems such as sleep disorders, anxiety, and depression. The pandemic has added uncertainty to uncertainty, fear upon fear, and as in many European countries, the mental health of French population deteriorated. Government survey conducted in March and November 2020 found that 10% of French population had suicidal thoughts over the course of the past 12 months. It doubled the already alarming rate of 5% from 2017, and the prevalence of anxiety and depression also doubled. Since then, in France, we had successive lockdowns during which people were able to leave their homes for 1 hour and not further than 1 kilometer from their homes. That would be 0.6 miles. Social distancing, travel ban, remote work, it didn't help the cause. And according to the latest data from December 2021, 18% of French population shows signs of depression. That is an increase of 8% compared to pre-pandemic levels. Then 23% show signs of anxiety. That is an increase of 9% compared to pre-pandemic level. And 68% of French population reported sleep problems in past 8 days. That is an increase of 19% compared to pre-pandemic level. The psychological impact of the COVID-19 will be one of the major challenges in the coming years. And in the shadow of pandemic, another health crisis escalated in France. Mental health care, once a national pride, found itself decimated by the lack of both financial and human resources and mounting case load. In a country with a long tradition of psychoanalysis, there are almost 3 times more deaths by suicide than by road accidents. In a country where almost a quarter of population have mental health problems, those who experience them have to wait between 18 to 20 months for the first appointment with a psychologist. There is shortage of mental health professionals, and those long waiting times are even longer in rural areas of France or in densely populated regions, such as Paris. There is no mental health professionals to meet skyrocketing demand. And once again, I would like to emphasize that mental health problems are the most expensive pathology in France, way ahead of cancer. And once again, French people may have to wait almost 20 months for the first appointment with the specialist, and the very same waiting time would be completely inconceivable in an oncology department. In addition to the long waiting times, there is a complete lack of prevention in France. There is a complexity of mental health care delivery. There is no coordination between physical and mental care, and there is also strong stigma surrounding mental illness. France is well known for its clinical research, but it is also important to understand that money usually goes to cancer research, and only 4% of money spent on research go to mental health research. And in France, there is very complex system of prevention. There are too many actors involved in prevention strategies at different levels, national, regional, local levels, and it makes already underfunded system very difficult to manage. And in developed European countries, almost 3% of GDP is spent on prevention. At the same time, France has one of the highest level of public spending on the healthcare, but when we speak about prevention, France spends less than average. In developed countries, that would be around 3% of GDP. In France, that's less than 2% GDP. And the French healthcare is hospital-centered with a very archaic primary care, and it remains cure-oriented to the detriment of health promotion and mental illness. The tempting explanation of the French mental health crisis, but not necessarily the true reason, would be American hegemony. The easiest way to explain something is to blame the United States of America. So the story goes on. A few decades ago, psychiatry and psychoanalysis were practiced in France with a lot of interests. New generations of practitioners are considered as innovators and entrepreneurs. They improved mental health treatment in France. They developed numerous innovative services such as crisis centers, daycare facilities, therapeutic workshops. Many of those services became standard for the care of patients with cancer or HIV. Psychiatry and psychoanalysis were pioneering, innovating, then linked with imaginative sciences like philosophy, sociology, and literature. But then, all of a sudden, overprescription of psychotropic medications, and of course, diagnostic and statistical manual of mental disorders came across the Atlantic, and it allowed no room for maneuver and prevented French therapists from providing comprehensive and individualized treatment. That is what we would hear from many French psychiatrists, but we know that overprescription is not just an American phenomenon. That's the first fact that I would like to emphasize. About 90% of consultations in France result in prescription, averaging between 3 to 4 different medications. Half of children aged under 2 has taken more than 9 medications per year. Steroids and antibiotics are routinely prescribed. French doctors are 5 times more likely to prescribe steroids than American doctors, and 20 times more likely to prescribe them than Norwegian doctors. France has the long-standing record rate of antibiotic consumption per inhabitant in Europe, so maybe that would not be the true reason of the French mental health crisis. So to understand the true origin of national mental health crisis in France, we have to have a look at 1960s, when new French mental health care system was born and emerged out of tragedy. During the Second World War, 76,000 people died in French psychiatric hospitals, among whom 45,000 because of hunger and its complications. Mental patients were forgotten in huge and overpopulated asylums built in 19th century far away from the big cities. That is why the post-war France opted for deinstitutionalization. The mental health care is delivered outside the hospital environment and separately from the rest of the healthcare in totally distinct and parallel system. The entire France has been divided into 800 psychiatric sectors, general psychiatric sectors, and about 300 children and adolescent psychiatric sectors or geographical zones. Each sector is placed under the responsibility of unique medico-social team led by senior psychiatrists attached to community mental health centers. Those community mental health centers, they're even located in separate facilities to mark their separation from the general health care, and access to mental health services is based on the residency in a given psychiatric centers. And the nationwide reduction of psychiatric beds was followed by the development of community care in some parts of the country. Day hospitals, crisis centers, therapeutic workshops, and home treatments, they became norm in pioneering psychiatric sectors. And by 1990s, it became clear that minority of those sectors provided most outpatient services. Sectors in rural parts of France, they only provided services in those big mental hospitals built in 19th century. And instead of providing both integrated and individualized care, this sectorization policy created new inequalities. Then, between 1990 and 2011, France closed more than a half of its psychiatric beds, while the alternatives to hospitalization haven't been sufficiently and evenly developed across the country, or they have been cut as a result of austerity measures. People with mental health problems started to fill up hospitals again, while the number of beds was decreased. In addition, quasi-constant reforms of mental health care in France created fragmented landscape of mental health care institutions and services over which no one has a complete overview today. And this incredibly complex and underfunded sectorial organization separated from the general health care resulted in mental health care being considered as its poor, distant, and neglected relative. And we know that separating physical and mental health is both inadequate and expensive. The mind and body are connected. 2 in 3 persons with mental health problem also suffer from chronic somatic disorder. 1 in 3 individuals with a chronic somatic disorder also suffer from mental health problem. But the quest to understand the relationship between the mind and body constitutes an ongoing and seemingly never-ending debate in France. One of the most lasting legacy of René Descartes' philosophy is mind-body dualism. And this dualistic approach played a certain role in this clear but artificial separation of physical and mental health care in France. The lack of coordination between mental and physical care has devastating effects in France, both on individuals and the healthcare in general. More than 90% of those who attempt suicide are treated in emergency departments of general hospitals, while mental health treatment is provided in community mental health centers, which are located in separate facilities. Then we know that mental patients, they are very complex patients. They are expensive patients, and they are very poorly cared for in French general hospitals. They use more unscheduled hospital care, and the rate of attendance in general emergency departments is 3.2 times higher than the general population rate. The separation between the physical and mental health care additionally reinforce the stigma. Mental health problems are still taboo in France. 75% of French population consider that those affected are dangerous to themselves or to the society. 1 out of 3 people in France would be embarrassed to share a meal or to work next to the person with mental health problems. The fear, ignorance, misunderstanding, denial, and guilt still lead to discrimination, abuse, exclusion, and treatment delay in France in 21st century. People, they don't seek treatment because they don't think that it would help them. It is still widely believed that there is no effective treatment for mental health problems, which are considered as inevitable after traumatic life events. Or physicians are routinely consulted for insomnia, fatigue, lower energy levels. They prescribe medications for those symptoms, but they don't offer or suggest any psychological support to find the origin approximately 30% of all patients seen in primary care in France, they have mental health problems. So the responsibility for mental health treatment in France very often falls on the general practitioners. Mental health care is daily routine for them, but also one among many other priorities, like the treatment of acute illnesses, chronic illnesses, prevention, or medical emergencies. Moreover, the average consultation time in France is less than 15 minutes. Can you do anything in less than 15 minutes? I'm not sure. Then many of general practitioners lack specialized knowledge about mental health, and there is no coordination with professionals in the field. Dissatisfaction is shared both by professionals, by general practitioners, and by patients. Integrating mental health care into primary health care would provide better access to mental health services in France. It would make them available in geographical proximity and less stigmatizing. Properly trained and supervised primary care providers are critical for early identification of mental health problems, and with more appropriate referrals, they would also reduce long waiting times for the first appointment with specialists. And the COVID-19 crisis put mental health in France at the top of the political agenda. Recognition of its importance provided a favorable context for much needed reforms. A crisis always reveals the weaknesses of the existing system. It creates a special environment by putting strong pressure on the system and helps the emergence of its new functions that are vital to move forward. In 1959, John Fitzgerald Kennedy, then still a senator, famously said that, quote, "When written in Chinese, the word crisis is composed of two characters. One represents danger and one represents opportunity." And French mental health care faced an urgent need for reorganization in the context of absolute unpreparedness and the striking lack of means in the early months of the pandemic. The emergency bite plan to face a massive surge of patients due to accident, epidemic, or catastrophe was quickly initiated in all general hospitals. Blue plan, created after European heat wave when 14,000 people died due to heat wave in Europe in 2013, is activated on the same day in facilities for disabled people. But those plans, they were not appropriate for mental health care facilities. Even the Saint-Anne Hospital Center in Paris, which is national reference in psychiatry and neurological science, it was not even included in the mass distribution plan. Many mental health care centers, they had to be closed. But even more pressing issue was to create mental health care able to sustain the pressure of any new crisis in the future. The COVID-19 has heightened the risk factor generally associated with poor mental health, such as unemployment, financial insecurity, fear, while protective factors, including social connection, educational engagement, physical exercise, daily routine, felt dramatic. Lockdowns, curfews, and physical distancing have contributed in flattening the curve of the pandemic, especially in the big cities like Paris, but their negative impact on the mental health is undeniable. People were self-isolated at home, trying to work while managing the household and dealing with uncertainty, fear, and even pandemic. And you have to understand that in France, with its history of enlightenment, life is lived on intimate scale. Paris is one of the most walkable cities in Europe, where your car would be just a burden. People meet, read, write, and plot in overcrowded coffee houses. They bump their shoulders on the street or in the public transportation. They greet their friends with 2 kisses on the cheeks. So the overall impact of strict lockdown measures, closure of non-essential businesses, and physical distancing had even more devastating effects in France with its pedestrian culture of proximity. Nevertheless, the pandemic could play a certain role in reducing the stigma surrounding mental health, because being vulnerable during the COVID-19 became socially acceptable. Everybody was affected, and to a certain extent experienced how the life with anxiety might look like. The pandemic also showed the importance of mental health interventions. French health professionals, they have open hostility towards mental health interventions, but at the beginning of the pandemic, when community mental health centers had to be closed, alternatives had to be developed, and mental health interventions can find their well-deserved place in the post-COVID-19 France. But what is even more important, I will finish in 5 minutes, I have a look at the watch. So what is even more important is that in January 2021, the French government announced that psychological consultations will be reimbursed for children, adolescents, and university students. However, this check C because in common language, both psychologists and psychiatrists in France are called psy, reached only small number of those in need. Why? Because there is a need for the general practitioner's referral. There are administrative hurdles, and those consultations are reimbursed at a flat rate of 30 euro per session. It significantly reduced the efficiency of this measure. But in September 2021, in the closing speech of the National Mental Health Convention, French President Emmanuel Macron announced the new measures to boost the French mental health care. French President acknowledged both the psychological impact of lockdown measures and past government's failures to make mental health a priority. French President promised the reimbursement of consultations with psychologists for the entire population. He promised the creation of 800 new jobs in community mental health centers and extra funding and support for research. It was announced that health insurance would fund up to 8 sessions with psychologists, with a limit of 40 euro for the first session and 30 euro for the following sessions, with a possibility for prescription renewals. President Macron made it clear that this is not intended for anyone who can already afford therapy, nor for psychologists who charge well more than what those rates are. He made it clear that this policy is intended for psychologists who cannot make decent living, and for population which is not able to get help unless prices are regulated. There is a consensus among professionals in the field that this reform is long overdue, especially in the context of the pandemic. Nevertheless, the Hospital Federation of France welcomed the announced measure. They said that historical underfunding of psychiatry should come to an end, but at the same time, professional organization of psychologists and unions, they hit back. They said that those measures are insufficient and humiliating. They insisted that professional independence is in grave danger since consultations will be reimbursed only if prescribed by general practitioners. That is why we had protests of psychologists in the street of major French cities. And on 22nd of October 2021, French National Assembly legislated for consultation with psychologists to be covered by the health insurance, but the devil is, as usual, in detail. In the country where psychologists charge between 50 and 70 euro for a session, only the first consultation that cost 40 euro and subsequent sessions that cost 30 euros would be reimbursed. Psychologists who charge more than those rates are completely excluded, and it is still unknown what will be the rate of reimbursement provided by the statutory health insurance, which is mandatory, and what will be reimbursed by mutuelle, which is usually unavailable for those in need. And in any case, there is no doubt that those measures are not needed. And there is no doubt that those measures, they are not a giant leap for French mental health care, but they are undisputably a small step forward for everybody in France. Thank you for your attention, and I think that we have at least 10 minutes or more for questions.
Yes, thank you.
And we have a thank you slide, I think.
Oh,
Okay.
there you go. Yeah, so question.
Question, I mean, not really joking, but are you guys recruiting for mental health professionals? You're in need of them? Is there like any kind of recruitment programs?
There is a shortage of psychologists across the European continent.
Sure.
And French mental health services are provided by French speakers for French speakers. So finding an English-speaking therapist would be almost a mission impossible. So there are opportunities, but at the same time, to get your professional qualifications recognized in France would be extremely difficult and complex procedure. It is also costly. What might be a way would be to go to France and to obtain master's degree in France and then to get your license to practice there. And I would like to emphasize that public universities in France are very prestigious, and tuition fee is about 500 euros per year. Sorry? But they are
all
in
in
French,
French.
but there are some programs in English. Not many of them, but it might be possible to find some programs in English. And housing expenses in Paris are another topic.
Right.
I hope that I replied to your question.
I'm curious about, because of the lack of psychiatric help in general, are the médecins généralistes, are they most likely to prescribe psychotropic medication, even if it's outside of their
Exactly.
throw medication?
Exactly. They
That
prescribe them routine. They prescribe them routinely. France is top global user of antidepressants.
Oh, really? Wow.
That's clear.
Dr.
And,
Jason.
and access to specialized mental health services is very difficult. It put additional pressure on general practitioners, so the easy way for them is to prescribe drugs, and that is what they do.
I'm also sorry to follow. I'm just curious, like at the university level, I studied in Paris a long time ago, and I remember there was pretty robust healthcare service for us as students when we were there. But I'm wondering if that's still, are students able to go see somebody within the university to talk to if they need, or is that?
Those services, they exist, but they are almost invisible. You cannot find them, or even if you find them, even if you know where they're physically located, there are huge chances that you would not find anyone there. They would be exceptionally closed. And if you really struggle with your studies, there would be no mental health with big public universities in France. That is why in January 2021, French government introduced this check C to cover psychological consultations, not only for children and adolescents, but also for university students. But once again, only 8 sessions are covered. There is a need for general practitioner referral, but that might be a way to access psychological services in France, but there is a huge shortage of psychologists. So it is an open question whether you would be able to find available psychologists.
Yeah, so 8 sessions max. Kind of sounds like Kaiser. Sorry if you have Kaiser, but I'm telling you. And then it's grouped. They really push you with the group, which is fine, but only 8 once a month of a group. So, yeah. And then you're getting paid $30 an hour to be a practitioner. And what does it cost to live in Paris?
That is really the biggest problem with this policy, because French psychologists, they charge between 50 and 70 euros for a session, even more, especially in Paris. And now for the general population, consultations, only the first consultation that costs 40 euro and subsequent sessions that cost 30 euros could be reimbursed. All psychologists who charge more are completely and absolutely excluded. So not only that there is a shortage of psychologists, but you have to find one who would be willing to charge you just 40 euro for the first session and 30 euros for subsequent session. And there are some other administrative burdens for everybody involved.
Yeah, by the time you get reimbursed, you probably spend another hour per hour. So now you're making $20. And then, 8 sessions, which is getting, is not sufficient.
So this is really a small first step.
Yeah, at least it's a step, right? Yeah. Dr. G, any?
Yeah. First of all, thank you for your presentation.
You're welcome.
And I really want to thank you for that second slide. I want you all to think about what you saw.
Let's go back.
Immediately to the second slide.
One of the protests.
Oh, yeah, that's let's see, let me find it. Oh, with the colère, Sicoles, yes. We're mad.
Because one of the things I talk about with my students is that we're in a very new world. that we
Yeah.
haven't figured out.
Right.
And one thing we haven't figured out for this country especially, is that as therapists, you must be advocates.
Mhm,
You can no longer just be a therapist.
mhm.
You have to fight for your own right to survive, as you're pointing out, but also for the care of your patients. So it's a whole new level of thinking in terms of becoming a therapist, because most come in, they want to be therapists and get a private practice, a nice little office, and that's that. It's not that anymore. We have to be there for your comrades.
There were a lot of protests since the end of January 2020 when the government introduced that first reform, and then they continued in September 2020. This photo is taken in Leon. That was the date of the closing date of the National Mental Health Convention. There is when President Macron announced this.
Yeah.
But once again, those measures are welcomed by hospitals, and they are considered as insufficient and humiliating by psychologists, and they continue to fight for their rights on the street of major countries.
Thank you.
And what's the population of France?
Population of France is about 75 million inhabitants.
We have to, well, what do we have, like 340
340 million.
million? I mean, yeah, right, so, but, you know, to your point, Dr. Gonzalez, the advocacy doesn't need to be here when you're calling. I mean, I don't accept insurance, but I do give a super bill. So I get a report. At one point, I had somebody who was actively suicidal. She was a Kaiser. They're trying to have her do outpatient. So I called them up and I said, you need to get her into a hospital now, or I'm calling the insurance commission. You know, because a little group once a month is not going to help her because they're trying to avoid putting her in the hospital. So you're going to have to be willing to do that kind of thing at the very least, because the goal is the least amount, you know, of service as possible.
Right. And I think we had one question here.
It's just, I don't know, it's ridiculous to me. I mean, to think that you have to like jump through hoops. I mean, is it displaced to be outraged that you have to jump through hoops to get any kind of mental health care, and then there's people willing outside of France to get mental health care, but you have to jump through
I'm
so
sure
many
Ricardo's had this. I mean, you get question. Ours is the least expensive the least expensive of the healthcare that they will ever provide. We know there's all kinds of research that shows the prevention of long-term problems with, you know, high blood pressure, heart disease, all that, right? It's the least amount. The average person goes 20 sessions, figure, okay, $100 a session, $2,000. What do they pay for $2,000? You can't even go to a hospital for a day for that. But then they're nickel and diming us. I talked to my physician, it was $275, 10 minutes on the phone. And insurance pays that. So yes, it's outrageous that they're looking at the little the least expensive, most efficacious prevention of long-term problems. But we have been really remiss, you know, I think we made a devil's bargain by saying we want to be covered by medical insurance. And then we've just kind of gone along with whatever they're charging. And that's the other thing. You know, they'll tell you what you can charge. And if you say, well, but my client would pay a little extra because my regular fee is no. And you get 10 sessions. Right? Do they ask you what you're doing with the client? No. Not one time. So all this baloney about you have to use CBT because that's what they want. They don't even know what they do, and you do, they don't care. 10 sessions, and you got to call again and get another. Right. So yes. It's, and where is, you know, the advocacy? I don't know. AMFT, APA, I don't see them. So, but then the other relation to this is the stigma, as you mentioned in another talk, with, you know, the embarrassment of going to someone, and you probably, well, I know I have, I shouldn't have to come in here to see you. Everybody else handles their problems on their own. Where that gets started. And so I don't want you to tell anyone I'm coming here. You know, if I'm an airline pilot, I might not be able to fly if I'm going to see a therapist, which is ridiculous because they're addressing something proactively, but no. Then you start to wonder how many airline pilots should be seeing a therapist and aren't, and you're flying with them. So there's the stigma that's also embedded, and I think that shows up. You made a quote about how research done on psychologists and psychiatrists' attitudes towards the mentally ill were worse than the average person.
That was staggering for me. There was a survey conducted in psychiatric facilities in Switzerland, and they used identical questions for the general population and for mental health professionals. And the results showed that mental health professionals, they hold more negative views, more prejudicial views towards persons with mental health problems than the general population. Psychiatrists hold more negative prejudicial views than both psychologists and the general population, and they're not willing to closely interact with those, not more than general population. The result also showed that psychologists and psychiatry, they have profound knowledge about mental health. They advocate for the rights of people with mental health problems, but at the same time, they hold more prejudicial views and they're not willing to closely interact.
So there you go. You have a question?
Yeah, just real quick, I just noticed a lot of similarities between delivery as far as the US and France, some barriers, and I was just wondering if, I've never been, is there we have a large homeless population, a lot of that's due to the psychiatric issues going untreated and stigma behind that, a lot of veterans, whatever, people just lose their job, don't get help. First line of treatment is going to be the ER, and that oversaturates, it just causes this huge societal issue. Saying that nothing ever gets resolved.
There is the same problem in France. System is hospital centered, archaic primary care. So many people, they end up at the emergency rooms of general hospitals.
Or the prison.
And then there is that complete separation between general health care and mental health care. There is no coordination between mental health professionals and doctors in general hospitals, and it has disastrous effect on the entire system and on the individuals.
Well, and here they are in prison. You could deliver mental health service. Where are they going? They can't go anywhere. They're here. It's the same with substance use treatment. They're right there. You know, they could go if they don't want it, fine. But most people would rather do something than nothing when they're in prison. So we have a captured population that we should deliver these services to that we don't. Huh? You know, so that's another, I mean, they quote all these statistics, but part of it is somebody who's mentally ill, what are they, where's their advocacy group? Same with people who have used drugs. You know, so that's not the ones who, you know, I'm sorry, but money talks. And, you know, where's that 1% of the money that people with $1 million or more, you know, they're paying 1% for mental health in the United States. 1% of the, in California, where's that money going? I keep trying to find it. Because there's no accountability, right? The state of California, the citizens said we want to fund mental health. Well, if we make $1 million or more, we pay 1%. And for how long has it been? 10 years? And every year the agencies are like, well, I don't know if we're gonna get any funding this year from that. Yeah, so, and you know, it's not like the homeless are out there with the picket signs going, hey, where's our funding? So, yeah. Anyway, we're not alone, as you can see, other people are struggling, but, you know, we keep fighting the good fight, right? Thank you for joining us. Thank you, Joshua. Bueno, we'll take a break. Yes. Now for something completely different. Okay. I shall pause.